Thanks for tuning in and welcome to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. I'm Ben Blanc, Director of Digital Production and Engagement at the Global Healthy Living Foundation.
And I'm Robert Popovian, Chief Science Policy Officer at the GHLF, based in Washington, D.C.
And today we're bringing you something a little different, a special episode recorded live from the World Vaccine Congress here in Washington, D.C.
That's right, Ben. You know, I was invited, similar to last year when we did the podcast live from here by the World Vaccine Congress to speak and present some new data that they've garnished throughout the year from GHLF, as well as to moderate a couple of panels. So we're here very excited to talk about those stuff.
That's right, Robert. And we've had the chance to talk to vaccine policy experts, coalition leaders, and folks working on the ground to improve access. And we're excited to share some of those conversations with you all today. So let's get started. So Robert, let's start with the big picture. This year's Congress is happening at a unique time. There's a new administration, budget cuts, and layoffs at key agencies like HHS, the CDC, the NIH, and a growing measles outbreak in several states. All of this has stirred new debates around the future of vaccine access and policy. So with all that in mind, what are the big conversations happening at this year's World Vaccine Congress, Robert?
As always, Ben, the discussions in World Vaccine Congress have to do with how do we get patients immunized at a higher rate. There are definitely challenges this year with the new administration coming in and changing the inflection point of some of the policy debates. But the mission never ceases to exist, which is we need to immunize more people because, as you well know, and we've discussed multiple times on our podcast, immunization rates, vaccination rates of adults in the United States far lags behind what the requirements are. So again, the same thing applies to this year is that how do we get to a point that we are immunizing patients, adult patients, to a level that will provide them coverage and better outcomes as patients?
Yeah, thanks, Robert. That really helps frame a lot of what we've been hearing here. And, those themes are definitely reflected in the interviews that we've recorded with our guests. So we'll get into their interviews in just a minute. But before we dive into those, for those who may not be familiar, the World Vaccine Congress is one of the largest global events dedicated to vaccines and immunization. It's held every year here in Washington, D.C., and brings together public health agencies, researchers, biotech leaders, policy experts, and pharmaceutical companies. The event covers everything from cutting-edge science to vaccine equity, innovation in delivery, and public health policy. It's a space for cross-sector collaboration and a real catalyst for moving vaccine access and innovation forward. So let's kick things off with Abby Bownas, someone that you know pretty well, Robert. She's collaborated with GHLF many times. Abby co-leads the Adult Vaccine Access Coalition and is a national leader in immunization policy, especially when it comes to adult access and financing. I was able to interview Abby right after she participated to the panel on the topic of what's at stake as we're aiming at moving towards seamless vaccine access for adults. Let's hear our interview. Abby, it's great to see you again, and thanks for taking the time to chat with us during such a packed week.
Thanks, Ben. It's great to see you.
Thank you. Well, all right, let's start with the big picture check-in. What's top of mind for you at this year's Congress?
Well, it has been a difficult time in the vaccine policy space. And so being here at the conference has been a great opportunity to hear about some of the topics that others are paying attention to right now and really what their recommendations are or how they're navigating this moment.
Now, zooming in a bit, based on your coalition work, what policy change would make the biggest impact right now on adult vaccination?
It's a tough question. AVAC's working on a number of different policy issues at the moment. I would have to say, given the time of year and just what's been happening in terms of some of the recent cuts to funding, funding really lifts up kind of top of mind. And when I say funding, I mean for immunization infrastructure. And when I say immunization infrastructure, it's all the various components from actual vaccine doses to education, to all the data pieces that go along with that. And it's a really important I think, time to support funding for immunization at large.
Now, I know you also spoke on the panel about seamless vaccine access for adults, which was moderated by Tommy Acciani, who we are also interviewing on this episode. What were some of the key takeaways for you, especially around the Immunity for Adults program and how states can use data to improve vaccine uptake?
Thanks. Yeah, Tommy did an amazing job moderating the panel. And I think one of the things that he really brought out in the discussion is kind of what levers do we have to try to change policy right now. And so we talked a lot about funding, which I also just mentioned. But during our conversation, we also talked about how are we supporting providers? How are we supporting public health right now? And what happens between public health and healthcare systems? When one perhaps funding goes down, how do the other pick up all the work that still needs to be done? And so it's a really great discussion. The panel had a lot of great perspectives. Big Cities Health was there. We also had the Infectious Disease Prevention Network. So a lot of really interesting perspectives on kind of what the local needs are and what some of the state policy challenges and opportunities are right now, too. So it was a good crossover, I think, between federal, state, and local discussion.
Awesome. Well, thank you so much for your time and for your insights.
Thank you.
So Ben, Abby shared a lot of information with you. She is a dear friend, Adult Vaccine Access Coalition. She co-leads that, but she's also a leader at the American Disease Prevention Coalition, which I am very active in. And what she talked about is exactly what we've been hearing from other attendees at the vaccine conference, which is there's a great deal of hesitation about immunization in the United States currently, especially among adults. How do we go over that barrier? And what are AVAC and ADPC doing with regards to educating patients, providers, and legislators, policymakers about the importance of immunization, especially in the adult space? So up next is Tommy Acciani, who is with GSK, GlaxoSmithKline. And he joined us similar to last year. He came on our podcast and he spoke about some of the events taking place at the World Vaccine Congress. He leads the U.S. vaccine policy engagement at GSK, so he has a lot of knowledge. And as I said, we work with Tommy all the time, both on the national level and on the state level on vaccine policy issues. So here's Tommy's interview with Ben.
Tommy, always a pleasure. Appreciate you squeezing us in between panels, especially after moderating one yourself. So first thing I want to know is how do events like this help move the needle in your field?
Yeah, so this is basically convening a conference, and what we can do together is all meet amongst our areas. So it's not just commercial, it's not just advocacy, it's not just policy making. It's got to be all of us that move the needle together. If you go it alone, you won't go as far. You might go as fast, but you might not get as far. That's the old adage: is if you want to go fast, you go alone. If you want to go further, you go together. So this provides that kind of like a collaborative table that we can all meet and discuss the issues and how we can kind of tackle them moving forward.
Now, let's talk about some of the ongoing challenges. What policy or regulatory barriers do you think are still slowing down vaccine uptake, and how can we break through them?
Yeah, it's a great question. We actually talked about this last year, and I would say almost all of them still exist. And I think I liked Robert's quote last year was the Byzantine-like barriers that exist in our ecosystem that are basically preventing patient access from moving forward and reaching more patients. Same things there. I do think that there's a stronger focus now on that provider recommendation and the consultation or the conversation that's happening between the provider and the patient. I know that's being stressed amongst this administration and the HHS secretary. I do think that is powerful, and we know that the provider recommendation is the strongest indication of vaccine uptake, and I really think that is going to be kind of the central focus of what we can move forward on. All those other systematic barriers exist, but really focusing, I think, on what we can do between that patient and the provider and really give the resources to our providers, better reimbursement, incentivize them to have those hard conversations with their patients that we know are becoming more and more problematic and taking more and more time to walk people through. There are legitimate questions they have about vaccine efficacy and safety. Vaccine skepticism is not unhealthy in a certain way. And being able to reach those people and answer those legitimate questions, I think, is very necessary. We need to be able to reimburse and provide our providers the ability to do that and take the time out to do that. And I think that's one of the biggest barriers that I think we could be focusing on in the next couple of years.
Thanks. And you also moderated a panel on how we are moving towards seamless vaccine access for adults. What stood out to you from that discussion, particularly around the Immunity for Adults program, misinformation, and what might happen as the CDC Bridge program comes to an end?
It's a great question. I think I'll answer the first part. The last part first. I think the overwhelming theme of the panel I was moderating was funding cuts, and what the trickle down funding cuts are going to happen up at the federal level, the state level, and all the way down to the local level. Especially with federally qualified health centers, a lot of the immunization programs that are done at the local level and the city level. Funding was a big conversation, almost overshadowing all those other policy considerations that me and Robert talked about last year that are still present in the system. Funding seemed to be the biggest thing. And it wasn't just money, it was also the workforce and the actual people and the staff that are doing a lot of that good work. You still need somebody to eventually put a shot in an arm of a child or an adult patient, and that is being impacted by the funding. The drive, all the CDC funding, so any of the programs, is just the ones you talked about, but also like systematically throughout the entire immunization program and all the funding that's there. And identifying those problems, they seem to literally overshadow everything now, given the political environment that we're in.
And just to wrap up on a lighter note, is there anything that you've heard or observed at this year's Congress that surprised you or gave you a fresh perspective?
Yeah, it was great seeing Stanley Plotkin's keynote address yesterday, and I think he highlighted basically the power and the value of vaccines. And despite the rhetoric that's happening right now and the politicization that we've seen with vaccines, they're still one of the best public health interventions we've had in this century.
All right. Well, thank you so much.
Yeah,
Thanks
I
for
appreciate it.
joining
Thank
us.
you for having me.
Well, Tommy shared with us a lot of stuff with regards to innovation, vaccine innovation, and how the pharmaceutical industry is challenged with some of the policy barriers that exist. So it was a very enlightening conversation that he had with Ben. And I hope that you guys all learn a lot more about what the challenges are that the pharmaceutical industry is facing with regards to the future vaccines in the United States.
Thanks, Robert. And we also spoke to Rekha Lakshmanan, Chief Strategy Officer at the Immunization Partnership. Rekha has long been a leader in state-level vaccine advocacy and coalition building to support immunization access and combat misinformation.
So, Ben, Rekha is one of those individuals that really understands how to build a coalition on the ground with patients and providers. And let's hear from her right now.
Rekha, so glad we could connect. I've actually really been looking forward to hearing your insights on state-level advocacy. So, what are the biggest vaccine policy battles happening at the state level right now?
There are a lot of policy battles that are happening at the state level right now. Some of the things that we're concerned with is a rolling back or an erosion of routine school requirements. Children have to be vaccinated in order to attend public schools, but we're seeing attempts to weaken those public policies. Additionally, we're seeing policies introduced that would make it easier for parents to opt their kids out of vaccines. I'm in Texas. I live in the state that is the epicenter of the current measles outbreak in the U.S. We have 624 cases of measles, and sadly, 2 children have died in Texas. And yet we are seeing lawmakers entertain policies that will normalize outbreaks and, frankly, normalize potential and future deaths. We're also seeing, threats to innovation and vaccine research and development, and which is obviously of importance to the audience and to the attendees at this conference. And again, when you start to see threats on innovation, ultimately it's going to be the public who suffers from that.
So I've actually heard the word innovation many times as I was interviewing people this afternoon. Another word that I've heard this afternoon is misinformation. And so my question to you is, when it comes to tackling misinformation, what role do coalitions play?
Let's see. In terms of tackling misinformation, it's a loaded question. Coalitions, I think, sort of serve as neutral ground. There's a lot of pushback and sensitivity, as I'm going to say, when it comes to
information that's coming from, state or even federal authorities, and they should still be, trusted resources. But coalitions can kind of be seen as a little bit more neutral. They are also typically embedded in the communities. And we know that trusted messengers are those that are in the communities who work with local communities. And so coalitions can kind of be that vehicle to try and help explain and educate community members about the benefits and the need for vaccinations.
And now I want to take a step back. So from your perspective, what's still missing in our national conversation about adult immunization?
I think what's possibly missing from the conversation about adult immunizations is a reinforcement that adults need to be vaccinated as well. I mean, obviously, we have a long history of ensuring, children are vaccinated against preventable diseases. Naturally, we vaccinate before, anyone, gets exposed to a potential infectious disease. But I think us big people get kind of lost in the shuffle, and we've got to figure out a way to talk about and to normalizing adult immunizations as well, and reminding adults that, wait a minute, vaccines don't end when you're a teenager. They are lifelong, and so we need to continue to reach out to different communities to reinforce that message.
Thank you. And let's end with a note of optimism for this interview. What would be something you want to put out there regarding vaccines?
I think what I want to put out there about vaccines is, this conference has given me a level of reassurance and hope. And what I mean by that is for someone like me who is in the trenches and kind of in the day-to-day battle of hearing and dealing with deceptive information when it comes to vaccines, dealing with lawmakers who are trying to make decisions that could potentially, set our public health system back. Just being surrounded by, hundreds and hundreds of people who are working feverishly every single day to move the needle forward, to advance medicine, and they all have a passion for what they do. And I think it just sort of reinforces that vaccine ecosystem that is sometimes hard to see when you're downstream, so to speak. And just being with so many people and the energy they have has just been really inspiring.
Well, that's amazing to hear. Rekha, thank you so much for your time and for your insights.
Thank you.
So, Ben, what you did with Rekha, and the thing that stood out most for me is that she's in the epicenter of what's going on with regards to immunization or lack of immunization that's taking place. She's based in Texas, and she brings a very unique perspective because, as you may have known with Rekha's background, she not only works with patients and providers, obviously in coalition building in the state level, but she also is a former colleague within the pharmaceutical industry that has worked on immunization. And again, she's in the epicenter. What is happening with the measles outbreak in Texas is very serious, and she's dealing about how to manage that and get patients to be immunized. And her commentary was dead right on the center of exactly what we need to focus on.
That's right. And finally, we had the chance to catch up with Richard Hughes, partner at Epstein Becker Green and lecturer in law at the George Washington University Law School. Now, some of you may know him from his time as VP of Public Policy at Moderna, where he helped shape the national vaccine strategy during the COVID-19 pandemic. Robert, you actually moderated a panel that he was on last year, I remember. So let's hear Richard's insights. Richard, thanks so much for joining us. With your background in policy and law, I'm excited to hear your take on what's happening this year. So what brings you to this year's World's Vaccine Congress?
Yeah, thank you so much for having me today. It's great to be here. I'm really excited. I'm speaking 3 days in a row, so there's a lot to talk about. I've been coming to this conference for a number of years, and I think with each and every year, it just gets better and better, just in terms of the kinds of conversations that we're able to have here. I will say that this is a very different year when you think about what we focused on in the past, which are typically, how do we resolve some of the barriers to vaccine access? How do we make sure that we can get vaccines in arms? We're really looking at a very different environment given some of the politics in the United States this year.
Why is it important for your voice to be part of this global vaccine dialogue?
Sure. Well, I appreciate the suggestion that my voice is important as a part of this dialogue. I really try to bring a multidisciplinary, multifaceted perspective to the dialogue. I'm not a scientist. I'm a lawyer. I'm a policy expert, an advisor to companies in the vaccine space, an advisor to advocates in the space. And so, I really like to, just bring to the attention of my colleagues here at the Congress some of the barriers to access, vaccine access that I see, some of the regulatory issues that I see, and then, increasingly just talking about some of the developments in this administration, and also, things like the role of the courts in vaccines.
Of course. Well, looking ahead, what are you hoping to walk away with this week? What's one thing that you hope to take back with you after this week, whether, it's an idea, a connection, or insight?
Sure. I think, there's so much to learn here, but I think the thing that excites me the most is when I'm here and I learn about new and different vaccine assets in the pipeline and realize that there's yet another disease that we're going to be able to prevent in the future. And that is something that really, really excites me every time, really like nothing else.
Well, we're actually going to talk next about your unique perspective. Your experience spans across sectors, industry, policy, law. So I'm curious, what legal trends are you keeping an eye on in the vaccine space?
Sure. So I think under the current administration, there are questions every single day, legal questions, right, about the actions of the administration. And so I'm getting asked a lot of questions about the legality of certain things the administration could do with respect to vaccines. And, that involves everything from how vaccines are recommended, the requirement that they're covered and paid for by health insurance companies, their approval at the FDA, the Vaccine Injury Compensation Program, which is a very important program that makes vaccine markets sustainable, and just a lot of questions about what the administration can and cannot do in some of those areas. And then, of course, there's always traditional public health law, which is a conversation I'm about to be a part of with some other colleagues in public health law, about the role of government in just making sure that people get their vaccines. And there are a lot of really interesting, really hefty issues around constitutional law when we talk about what it means to mandate a vaccine or ensure that someone gets a vaccine.
Well, thank you so much for your insights. Well, actually, one last question. What concerns you most about the current policy landscape around vaccines?
Yeah, so I think I'm concerned about misinformation and disinformation that can be disseminated at the highest levels of our federal government, unfortunately, and that's a concern I never thought I would have to have. So there are a lot of official policy actions, regulatory actions that are concerning, but I think that probably the blurring of the lines between real science and not real science is certainly something that concerns me.
Well, thank you so much for your insights. Really appreciate your time.
Thank you for having me. Thank you so much.
So, Ben, Richard is a good friend. I've known Richard for many years. We've worked together on policy issues. And as he mentioned, he's not a clinician, he's a policy expert, but he's one of the best policy experts we have in the United States about vaccine immunization and adult vaccine access. So the insights that he gave, especially regarding some of the challenges that are going to come up with this new administration and the liability issues that the manufacturers may face, are dead on, as I said, and it's a worthwhile listen to what he had to say.
Now, I want to turn to you, Robert. You've had a full schedule here. I sat on your presentation this morning, streamlining adult immunization policies to enhance access for equity. For those who couldn't attend, what were the key points that you shared, and what changes are you advocating for?
So first and foremost, what I did is in the presentation, we talked quite a bit about all of the research that GHLF, Global Healthy Living Foundation, has been conducting over the past several years, independently and in partnership with organizations such as the IQVIA Human Data Sciences, as well as the Progressive Policy Institute and the Pacific Research Institute, actually. And what we have seen is that over time, we've tried to uncover through primary research and also policy papers, what are the challenges regarding immunization for adults in the United States. We have gone into looking at, for example, who are the best providers of immunization in the community, especially in low-income communities. That happens to be through our research that we found it's the pharmacists. Pharmacists are far more accessible in low-income communities compared to physicians. And when you take into consideration Medicare patients, seniors, and especially the hours of operation, without a doubt, they're the epicenter of where adults get their immunization. But that's not where we stopped, right? We've done research, for example, on reimbursement issues. Does reimbursement impact vaccine uptake? We've also looked at state-specific laws that require a lot of jumping of hoops by pharmacists, and whether or not only they cost money, but they also reduce access for patients. And one of the key points that we figured out in that study, for example, there's a 26% premium if a patient gets immunized in a physician's office versus a pharmacy. So if policymakers are interested in saving money and getting more people vaccinated, there's no question that they need to make it easier for pharmacists to immunize. So our most recent research has to do with SCDM and risk-based recommendations by ACIP. And SCDM, which is shared clinical decision-making, and risk-based recommendations are a way that ACIP is moving forward with regards to recommending vaccines instead of routine recommendations or age-based recommendations, and the challenges that this causes. Number one, with regards to risk-based recommendations, remember, majority of adult vaccines, Ben, as you and I have spoken in multiple podcasts, acquire their vaccines in a community setting in a pharmacy. Risk-based recommendations don't work in a community setting, especially in a pharmacy. The reason being is that they require a full medical records of the patient. And as soon as you get into that type of a discussion, it creates a barrier that the pharmacist cannot provide that vaccine. The second thing, which is shared clinical decision-making, in theory is fantastic. The problem is that with the ability for patients not to have a routine recommendations and they have to have this discussion with clinicians, it creates another barrier. I remember the first time a shared clinical decision-making issue came up with our pediatrician, and his thing was, I have no idea what they're talking about. They want me to have a conversation with you. So here, we've had a conversation. Do you want the vaccine for your teenager or not? And it's very confusing. So in other words, that's what we're going to look into with regards to our future research. But Ben, the most important thing is that from a policy perspective, all our research points to that there's a lack of access for patients who are adults. Adult vaccination rates are low. Adult vaccination rates happen in a community pharmacy, not in a physician's office, not in a clinic, not in a multi-center health insurance company. Those are not the people who are providing the vaccine. So the easier we make it for patients to get their vaccination in a pharmacy, we're going to get more patients acquiring that vaccine and healthier outcomes for those adult patients.
Well, thanks for your insights on this, Robert. You also moderated a panel on provider support in underserved communities. The discussion touched on Medicaid, long-term care access, and provider training. So what stood out most to you from that conversation?
A couple of things that came up repeatedly by the panelists was reimbursement issues, whether it is lack of reimbursement or complications in getting reimbursed for vaccines, which does not motivate then the providers to provide the vaccine or does not allow them to provide the vaccine because of the complications in reimbursement. And the second thing that came out repeatedly is the vaccine hesitancy. I disagreed with some of the panelists, frankly, about whether or not it's a good thing to have mandates. Mandates are not a good thing. And they actually talked about it on the panel, that mandates did force patients or adult patients to get the vaccines, but ultimately they also caused a lot of the problems that we see today with regards to hesitancy, that adult patients no longer are confident about what the vaccines can do. So it was an interesting panel. There was a lot of dialogue, but I think that those are the two main takeaways that we figured out at the end.
All right, a quick wrap-up question for you, Robert. If you had to sum up the energy at this year's Congress in one word, what would it be and why?
So Ben, the main thing that I learned from today's conference is optimism. And the theme that came through is truly that this private sector needs to step up and do a lot more with regards to educating and improving access for immunization in the United States, especially with regards to adult vaccines. We have been doing a lot in the last decade or so, but clearly the vaccination rates are not where we want them to be. And we have a responsibility, whether it's Global Healthy Living Foundation, which is a patient organization, the provider organizations, the policy groups that are out there, the think tanks, as well as insurers, PBMs, and pharmacies, all of us to come together as private sector and really improve vaccine access for adults in the United States. So that's what I took away from this conference. True word is optimism.
Well, thanks, Robert, for all these insights. So many learnings in this episode, and that's it for this special episode of Healthcare Matters, live from the World Vaccine Congress. Don't forget to subscribe to our podcast on Apple Podcast, Spotify, or wherever you might be listening, so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It will help more people like you find us. He's Dr. Robert Popovian.
And he's Ben Blanc, and we'll see you all next time.